Well, welcome everyone. My name is Hallie Lincoln, and I am one of the co-founders of Backline and the director of the case management department. So as many of you know, probably Backline provides the music industry with tools to support their journeys of mental health and wellness. So today we will be chatting a little bit about what that journey can look like for you if you are considering pursuing mental health services through therapy or life coaching. And as with all of our programs here at Backline, participation and having, well, actually this one is a webinar, so it won't be camera on, but all of that is participation rather in the Q&A section today is encouraged but not required. But we, welcome everyone to put some questions that you might have into the Q&A section here, and we will try to get to them towards the end. And would love to just pass it over to you, Amanda, to introduce yourself.
Yeah, so hi, I'm Amanda Wheeler. I am an associate marriage and family therapist. I'm also a life coach. I work in private practice out of Los Angeles. And yeah, no, I'm super excited. I come from working in the music industry, worked in music for over a decade doing artist management and marketing. And now my focus in clinically speaking and just generally is music industry and entertainment and mental health. So, yeah, excited to be here and answer any questions people might have. I know it can be super confusing to start that journey of, maybe I need help. Who do I talk to? Where do I go? And yeah, I get a lot of questions from my personal friends of who to talk to. So I think this is very topical and a great way to just kind of answer questions and help start that journey for you guys. So yeah, happy to be here.
Yeah, thank you for being here. We're excited, of course, to have Amanda for a whole bunch of reasons, but definitely the fact that she works in both realms of, training to be a licensed therapist and also working as a therapist now, and then also working as a life coach. And so she has both perspectives, whereas I am just a therapist, but actually have done some life coaching myself. And I think that there are a lot of nuances, right, that sort of differentiate the two. So that I feel like there's definitely some overlap, and they can also look really different. So again, the focus today will be going through sort of outlining what the process looks like, what both of these things are, what are some of the differences, and then what is the process of pursuing getting into either life coaching or therapy or both with the provider. And so I thought that we would start today by passing over the ball to you, Amanda, and talking a little bit about life coaching and what that is.
Yes. Yeah. So I, as Hallie had said, I do both. So I'm a therapist and life coach. When I talk with somebody and, how do I determine which of these skill sets do I use? But life coaching is really a lot more goal oriented, which the way that I do therapy also focuses on goals. But for life coaching, it's kind of oftentimes people will come in with, I just want to be unstuck, or they're kind of going through a life transition or career transition, or just having some issues with, staying organized and need some accountability. So that's when I kind of will bring in that life coaching option, when it's really just okay, let's focus on right now and what your goals are and what is getting in your way of these goals. And it's really more practically speaking. So it isn't going into necessarily big, systems or family of origin stuff, things like that. I'll still integrate some, different ways of thinking that are very therapeutic, but it's really just focusing on what are your goals? How do we achieve them? How do we move forward from this point? So it's like, you right now, presently, who are you? Where do you want to go? And kind of coming up with the, like, do you have a 5-year plan, a 10-year plan, that type of stuff. So there's also more, might have more homework assignments, might have some type of reading assignments as well, but it's very structured. So it'll be a limited amount of time, and just kind of going through almost like a curriculum or so. So yeah, those are kind of like the biggest things when it comes to life coaching. And then, yeah, so Hallie, I'll toss it back over to you of just therapy. How do you approach therapy versus, yeah, like what a life coaching situation?
Before I dive into that, I have a few questions for you just to keep with the life coaching for a second.
Yeah.
I mean, I think that you have such a unique perspective, right? Having the training for both. And I will say that a lot of the folks in our Backline network also, even more recently too, have, like, if they were trained as therapists and then now have opened a new LLC and also practice as life coach. And I wonder, just like to look a little bit more deeply at sort of the nuances and like the ways in which how do you determine what is best fit for one person when you have someone coming to you saying, okay, here's what I've got going on? And do you ever find yourself, like, how do you sort of, like, you have both hats, right? And how do you sort of put one to the side, or do you find it helpful to have both of those hats on as you're doing either therapy or life coaching?
Yeah, I mean, I would say my life coaching is definitely like, the fact that I have training as a therapist means that I approach life coaching in a completely different way.
Right.
As a therapist, you know, someone might come in and have a certain goal or a certain problem, and you kind of, it's more so dictated by the client of, like, what do you want to work on today? What would be helpful? And going along that route. Whereas life coaching is really like, okay, this is your goal, like, it's much more directive. And yeah, I would say I just approach it in a much more direct way as a life coach. Whereas therapy is just a different thing. Like, it has so many more emotions involved. There's so much more context involved. But yeah, I usually on a consultation call, because I like to do that with everybody I work with, I will ask kind of like, what are you looking for? Do you have goals? And some people know exactly what they want to work on, and some people have no idea, and it has taken them everything in them just to get to the point of this 15-minute call. Right. Which I completely understand. I do think that also sometimes life coaching can be a bit less intimidating for people, just because they might have an idea of what therapy is from, TV or, watching Sopranos, or, people come in with all these different ideas.
Not a good representation.
Yeah. Yes.
There are plenty of those, but I remember that one specifically on The Sopranos being like, ooh.
Yeah. Like, this isn't quite
right.
But yeah, they have an idea of, like, sitting down on a couch and, just talking and somebody listening to them. Whereas life coaching, and I'm sure there are a lot of ideas of what that would look like too. But I think kind of people can come in and be like, oh, I'm working on myself. I'm working to improve myself. Sometimes people think that therapy is if something is broken or something is going wrong, which I don't actually, I think it's just a matter of perspective of how it's addressed. I think therapy is not necessarily just for something going wrong or something broken. And life coaching isn't just necessarily for working on yourself moving forward. I think it can be really reflective, and can, I like to really help people to gain insight into themselves and kind of what their patterns might be or why these things might get in their way.
That's where both of those hats, it sounds like, really do stay present with and how you approach your work. Because I think a lot of what you were just saying about, the reflection, the piece about your work being reflective for clients and looking at patterns and just processing through some things, whatever might be coming up for them, happens so often in therapy also, right? And I think maybe the biggest distinction there is like that's from the life coaching perspective, it's looking at those things from the perspective of now, right? What are your patterns now versus what are some of these patterns that might have been modeled for you by your parents? You're not going to go into that, for example, in life coaching, whereas you might with therapy.
Yeah.
Gotcha.
Absolutely.
I'm just looking at a few of the questions that we got from Instagram yesterday when we had posted on socials if people had any questions. And one of them was, are there folks who do both or a hybrid of sorts? And I guess I wonder for you, do you intentionally and like consciously approach and let your clients know that you're approaching your work by doing both, or is it more really sort of separated?
Yeah, I separate it I like to be pretty distinct about what we're trying to achieve. And I even have different like paperwork, different consent forms, just because it is so different. Like it really, it's just such a different mindset and approach. But I would say, people can definitely be doing both. I think that can be super helpful in, but just addressing different things. So even if you, did life coaching to kind of figure out, like maybe you're thinking about doing the career transition, and trying to figure out like, what would that look like? What are the steps that I would take? Life coaching can also have a lot of assessments like strengths-based assessments or career, like Enneagram, that type of stuff. And then once you kind of have that information, you can absolutely go to a therapist and process more of it of like, oh, like this came up in life coaching that I really am having some huge like self-doubt, self-worth things going on. So in life coaching, it would be identifying those and maybe coming up with some ideas of like, okay, how do we overcome those? Whereas you could then go to therapy and process like, where does that come from? Why do I, have this self-doubt? Like where does this come from? And, they can kind of work together.
Yeah, that's a really good point. This is giving me some ideas for my life coaching and my therapy, which I engage in both. I think something I really like about doing both also is having two different providers, right? If you are seeing a therapist or a life coach for a long period of time, I think I've been seeing my therapist for 4+ years. Sometimes, it's like, oh, maybe having a different perspective on this would be helpful. And again, not to say that the life coach I see is giving me a different therapeutic perspective, but it's nice to sort of have, two different, everyone, regardless of their training, whether or not they're a certain type of therapist with a certain license or a life coach has, different ways in which they approach the work and different ways in which they think about things. And so, just having the variation, I think, is cool and helpful. Cool. Alrighty, well, let's chat about therapy in contrast again with what life coaching is. So I think Amanda covered a little bit about this, but I think therapy, a good way to think about it is specifically on mental health, right? How is any of my mental health being affected by what's happening for me present day, maybe worries about the future or from things that have happened in my past. Every therapist operates very differently, and we'll talk a little bit more about sort of the different approaches and theories, not too much in detail, but some people are some therapists are sort of more solution focused, right? So you're coming in and specifically with this type of provider to look at what can I do right now as a solution to address this thing that's coming up for me? And that person might not go too far into past history and family of origin and all of those things. I am not a solution focused therapist, actually, so I can't even really speak too much to like what that looks like. But often it's not as long, or as the treatment is not as ongoing. It can be a shorter period of time. But even just to back up a little, I know a very present question for people is, how do I find a therapist? And there are a few different ways. Obviously, being a member of the Backline team and having case management be the program that I created and direct now, I'll talk a little bit about what that looks like for folks in the music industry who are coming to Backline to have us help guide them in the process of finding the right fit and finding a therapist or a life coach or a sober coach. We have a bunch of different providers in our network. So the case management program, I'll just give a little sort of rundown. One would go to our website and fill out the case management submission form that just gets a little bit of sort of top level information about who you are, what is bringing you to case management to chat with one of us about looking for certain resources, again, whether or not that's a therapist, a life coach, some substance abuse treatment resources, whatever it might be. What your position in the industry is, how long you've been in that position, and then again, what is coming up for you now. So I think some of our drop-down options are, anxiety, depression, grief, loss, effects of the COVID-19 pandemic, which, is something we obviously added to that form during the pandemic. And I'm often very surprised. Yes, I'm surprised and not surprised, I guess, at how often people still mark that as one of the things that they're coming to, as one of the presenting reasons that they're coming to try to find a provider, given especially how hard hit the music industry was by the pandemic. So then from there, you would be sent a calendar invite to, or a scheduler rather, to book a call with one of our case managers, all of whom are either licensed therapists or therapists in training, and all of whom have some sort of connection to the music industry. So I'll speak for myself. So my connection to the industry is via a family member. My brother has been in a nationally touring band for almost about 15 years or so. And so I've had sort of that secondhand perspective of what it looks like for him to be on the road, at one point, I think like 38 to 40 weeks out of the year, what it's like to be away from his family, his wife, what the transition coming back home looks like, all of those things. Whereas, that's obviously, as you all know, the music industry is a very unique place. And these are not things that people who, have a typical 9-to-5 are having to navigate. So all of our case managers, again, have a good understanding of the music industry. And we will then go through a little bit of an assessment just to find out from you, what are you looking for? Is it a therapist or otherwise? What are some of the things that are coming up for you? Are you looking for, trauma specific therapy, or is it, I'm struggling with anxiety, performance anxiety when I go out on tour, or I'm having, difficulty transitioning back from tour to home and then back out again with my family, that whatever it might be. And then from there, we tap into our amazing clinical network, which is made up of, again, life coaches, therapists, sober coaches, psychiatrists, psychologists, all of the above. I think we cover all 50 states at this point, and our main objective really is to find out, from you who we think might be the best fit for you. So by getting that information from you, we can then go to our network of these providers, all of whom have been vetted by one of the clinical team members to find out, what their background is in terms of training, and what is their connection to the music industry, if any. I would say about 85% of our clinicians have a connection to the music industry, whether or not that's personal or professional. And then from there, we, will connect you with that person, provide you with their contact info, go through insurance and payment options and all that stuff. But really it's just, hand-holding process. And we want to sort of take off some of that like front-loaded work for people that is really difficult sometimes. If you're feeling like, okay, I'm kind of in a crisis and I need to get in with someone, it's very overwhelming often to try to navigate finding the right fit. So Backline is here to do that work for you. So if any of you all who are watching this are considering exploring some sort of treatment option, definitely check out the case management program and we'll be happy to walk you through it. So that's one way, obviously specific to the music industry. Another way I think is a great way is word of mouth, right? If you have a friend who absolutely loves their therapist, this is how I found my therapist actually, and I love her, was through someone who said, I've been seeing X, Y, or Z provider. She's awesome. I feel really comfortable talking to her, et cetera. Like I think word of mouth referrals are really, really awesome and can go a long way for people, especially with someone you trust. Another way would be through your insurance. So you can always reach out to your insurance company and ask them to send you a list of providers that are in network with your plan. And I believe they probably would send you folks who have openings. That's the hope. And then I would say the last way, this is again why we try to mitigate this as much as possible at Backline because it's so overwhelming, but you can go to the internet and go to psychologytoday.com and type in, your zip code. Is that right? Yeah, your zip code, what your insurance plan is, what you're looking for in terms of maybe a specialty, that type of thing. And it'll populate for you a whole bunch of different therapists, and you can read more about them on their bios. So that's definitely, people have plenty of success with that often. It's very hit or miss for sure. All of this can be hit or miss, right? And we'll talk a little bit more about finding the right fit in a minute. Is there anything I missed there? Anything you want to add?
Yeah, I mean, I think that one of the huge benefits of, Backline versus going on Psychology Today is Backline already, well, one, they have that like personal touch of somebody who's going to like first hear what you're kind of looking for and then go and search for those specific things. So, and then they will reach out to the clinician too, just to make sure like, hey, is this what your fee is? Is this what insurance you still take? Because sometimes you can go on Psychology Today and it might not necessarily be clear.
Right.
But then also having that like direct connection too of like, all of the people are vetted. They all have some type of connection with the music industry. So that can be super helpful.
Yeah.
And that also like I'm involved or I'm on a collective. I worked with a collective of music industry therapists. It's called Music Industry Therapists. They are also all individuals that have worked in the music industry. So yeah, and they're amazing. They just published a book that is touring in mental health. But yeah, I think like having that go-to, and also just to reiterate, Backline is connected with music industry therapists. So you can always like go to Backline, they suggest this, like they, but having that therapist that you feel like you can really connect with and understands your industry, I think is super important. I can't tell you how many times when I'm talking with people and, they know that like I have been on tour myself. So I understand, just the ins and outs of that. Like Hallie, what you were saying about you have, your brother and that transition in between being on the road and being off the road. Not every therapist might necessarily understand that, which maybe that's important to you, maybe it's not. But that's just, I think like the biggest thing about like Backline versus just going on Psychology Today is having that like extra layer of like, oh, they understand where I'm coming from. They understand that it can just be tricky when you're unemployed in between tours and all of that stuff. So.
Right. I can't tell you how many case management calls I've taken in the last, almost 4 years since we started Backline, where people said, I can't believe I found you guys because I have had experience after experience of getting in with a therapist and spending so much of my time and money explaining to this person what my lifestyle looks like why I, struggle with substance abuse because it's, always there, right? Or why I haven't live a nocturnal lifestyle, or what it's like for me to be away from my home for the majority of the year, that type of thing. Again, the music industry has so many unique factors to it that are really challenging for people that I think, people have spent a lot of time having to explain that, and that's not why you are getting in with the provider. It's helpful with that person already having a little bit anyways of understanding. Not everyone that you're going to see, right, will be like Amanda that's been out on tour and really, really gets it. But having some experience either personally again or professionally working with other music industry folks has been something that we've always gotten really positive feedback about. Yeah, cool. So I won't go too far into this, but we want to talk a little bit about the differences between all the different types of therapists. So I am an LCSW and an MFT, so a licensed clinical social worker, marriage and family therapist. There are also LPCs, which are licensed professional counselors, psychologists, all of whom, right, fall under this umbrella of we are all therapists. The credentials don't so much matter, to be honest with you. The biggest the biggest difference is in people's training. So as a social worker, we're sort of trained more to look at things from a systems perspective, all the different systems in your life and how they interplay. Marriage and family therapy obviously has more of the training has more of a focus on working with couples and families. So I think some people get a little confused about which is the best fit for them there. And I would say as much as you can to just sort of, you could certainly ask people, and we'll talk about the consult call, but during the consult call, what their training is, if you're specifically looking for something, a certain training, but something that we're going to talk about in depth here is I think, by and large, the biggest thing is, do you feel comfortable with this person and are they the right fit for you in that way? So let's see. So speaking
really quick, one thing I wanted to add
about
what you just said about for marriage and family therapists, because I hear this a lot about people well, I'm not married and I don't have a family. Can I still go see a marriage and family therapist? Yeah. And the answer is absolutely. They are trained to meet individually with people, but I know just some of these terms can be super confusing, but I just wanted to clear that.
That's a really good point. Yeah, that's why I sort of say as much as you're comfortable with, just sort of throwing out all of that nitty gritty stuff about people's, credentials. It's not that important. All of these therapists, if they're good therapists, are going to be trained to work with individuals, families and couples. Some people just, specialize more in those things, specialize in having more than one person in the room, that type of thing. But then I know, someone that we work with in our network sees bands a lot, actually, as a family unit, right? And she's not actually trained as a marriage and family therapist. She just has a lot of experience clinically, and can handle having a whole bunch of different people in the room and working with that band as a family, if you will. Okay, so I know we briefly chatted, or I mentioned the consult call. So this is something that I was saying this to Amanda earlier, that I drill into people's heads really on any of the case management calls, is the importance of a consult call. It is, I just can't overstate enough how important it is to engage in a 10 or 15-minute call with whomever you might be considering as a therapist. So typically with case management, right, if we're able to, we want to be able to send you at least maybe 2 options. And I always encourage people to reach out to that provider. They'll provide a 10 or 15-minute free consultation call where it's a 2-way conversation, right? You can ask them questions about their training, what they specialize in, do they do in-person or telehealth only or a hybrid, what else might you ask someone? Are they a tools focused therapist? Like, are you guys going to be working on like tools specifically? Is there going to be more, process focus and looking more at family history and that type of thing? Versus, and then on the other hand, right, they can ask you questions. If I get a referral for someone that is presenting with something that I don't really specialize in, I'm not going to be the right fit for them. I wouldn't be serving them in the way that I would want to if they're presenting with something that I don't really treat often, right? And so I would then refer out. So it's helpful also for the therapist to hear from you what it is you're looking to focus on so that they can also understand if they feel like they're going to be the right fit for you. You obviously can talk about insurance, out-of-pocket pay, that type of thing. But I think the most important thing from that call is you'll get a sense, even in a 10 or 15-minute call, like a brief conversation, right? Whether or not you feel just a immediate, maybe not immediate, but like a sense of comfort, right? And if depending on your comfort level with getting into therapy at all, that can take some time. Everyone's different. But if you get the sense, right, that this person is just like cold and monosyllabic, and I don't know how the hell they're a therapist and they're probably not the right fit for me, I would listen to that instinct, right? You want to feel some level of comfort and what's another word for comfort? Yeah, just like a sense of being sort of invited to start sharing, because therapy is personal, right? And vulnerable. You don't want to be meeting with someone that you don't feel that instant connection or like level of comfort with. What else would you add there, Amanda? Anything I missed?
Yeah, I mean, I think, yeah, like I agree with what you're saying. And also, yeah, just having that trust, like somebody that you feel like you can trust, I think is super important. And also, say, oh no, it's gone. The thought, it's gone. But, oh, I guess it's also evaluating for yourself. How do you, what's important to you? Because some people might be like, I need somebody who's just going to be super warm and just listen to me and be this like, hug of sorts. And some people are like, I don't want that. I just want like somebody to tell me what it's like and just like tell me what's up. So that's another huge thing of like, are they more of a therapist that might just listen and reflect back to you of, kind of maybe set what some of their insights are, or are they more directive? And, some therapists, they give assignments in between. I mean, I know I like to really stick with goals, and even in my therapy business, like I like to be tracking along with like, are we still going towards, like, are we working on what you want to be working on and checking in on that? Because I think it can be helpful, but some people don't need goals. They don't want to be like as focused. They just kind of want to experience it and go through the process, which is totally fine. But I guess it's just evaluating like what you're looking for.
Yeah, and I think that like advocating for yourself in that way is so important. Like you can ask that question that Amanda just sort of outlined of like, are you someone who's going to really tell me how it is? I'm not really looking for that warm hug. Like I need someone here to help me make some changes in my life. And I'm someone who really responds well to like firm direction. And, a therapist is not there to tell you what to do because it wouldn't be effective, right? I could tell you all day, you have to stop drinking. You have a substance abuse problem, but I can say that to you all day and it might not, I mean, it's going to be very difficult on the other end of it, right? Regardless of what I think about it. It's really, you have to be ready to make those changes. And in therapy, you'll look at sort of what some of those barriers are, what some of the reasons are that it's challenging to make some of those changes that you might want to be implementing. But yeah, just advocating for yourself and being direct. I really, really appreciate it when clients first on consult calls are very direct, like this is exactly what I'm looking for. And then I can tell them whether or not I think I'm the best fit. And also in the treatment process of like, this is not really working for me. What we focused on last week didn't work for me. I want to take a different direction. Like that to me is so valuable when people can share, right? And I understand it can be uncomfortable. I totally get that. If I ever am any of your therapists, please tell me. Right? Because I think that feedback is like, we can't read people's minds, and every single person is so different, right? And so I always check in with people like, did that exercise feel helpful? Or is this, the last 2 sessions of this felt like a helpful direction for us to continue, and that type of thing. And I think, again, like, this is your space, your time, your money, your ability to take this tool and use it for change. And so if something's not feeling right, saying that,
Yeah, no, I think that's super important. And also, it can just be hard to communicate just on a human level. It can be hard to communicate your needs sometimes and advocate for yourself. So I think it's almost within that therapeutic relationship, it can kind of be a great test run for you, like for clients to be able to start implementing that. Because at the end of the day, I mean, I can't speak for every therapist, but I imagine they are there to help. They want to do what is most helpful for you. So don't feel like it's like, oh, I don't want to hurt their feelings, or I'll just go along with this. Because at the end of the day, like, we want it to be successful. We want it to be something that's really useful for you, that you can go about your life and it be an improvement. So yeah, I agree with you in that. Yeah, if something's not working, just feel free to say it to your therapist.
For sure. Yeah. I think in that same vein, I hear a lot from people. I've never really understood this term, but I've heard people say, I'm breaking up with my therapist. And I have always found that term to be a little confusing, but it kind of like makes me laugh every time I hear it. But I think that that's also can be a really difficult conversation, right? Where, and this is why I think I put such an emphasis on the front loaded part of the process of, again, if we send you, for example, through Backline, 2 therapists, calling both of them and seeing which one feels like a better fit for you. It may end up that neither of them are exactly the right fit for you, and that's okay. You can always circle back to us and we can continue to help provide some more options. But, I once had an experience where I started seeing a therapist, and by the 6th or so session, I was saying, I was in training at this point as a therapist, and I said to my colleague at my internship, she was like, how was therapy? I was like, it was okay. Like, I kind of dreaded it, and I didn't get that much out of it, but like, she's really nice. And she was like, how many sessions have you all had? I was like, well, I think this was like our 6th session. She's like, if you are dreading it and you don't feel like you're getting anything out of it, then she's probably not the right fit for you. And it had never even occurred to me, to be honest with you, that I had the, autonomy to end treatment with her and look for someone else. Right. And that has always stuck with me. And I can't tell you how many times I've heard from people on either case management calls through Backline or through my personal life, whatever it is. Oh yeah, I tried therapy once. I didn't really like the person I was seeing. And so I just don't think therapy is for me. And I was telling Amanda earlier, my sort of analogy there, which I don't know if it's a perfect parallel analogy, but we're going to go with it anyways, that, the way I hear that almost is, I was 7 years old on the playground and I tried to make a friend, and the guy, he's kind of mean to me, and I just don't think friendship is for me. Like, he wasn't the right fit for me. And so therefore I don't think I should, I don't think friendship is for me. It's like every therapist is totally different. Every therapeutic relationship is going to be different, right? And so if that person didn't feel like the right fit for you, you don't really jive with them, you don't get a good sense of comfort or trust with them, that doesn't mean, I promise you, it doesn't mean that therapy is not for you. It does mean that that therapist was not the right fit for you, and that's okay.
Yeah. And I hear sometimes too of people like, oh, like, I've been seeing my therapist for so long, I just don't want to start over with another therapist. Like, that, it feels like such a daunting task, which I completely understand. And there's validity to that. But what I always encourage people is that even just telling your story to a new therapist can be therapeutic as well, because it's kind of cool to see just where you've come from and where you've gotten to. Like maybe at one point when you started with one therapist, there was something in your life that was so important and you just couldn't see around it. And that was just the most important thing. I think it can be kind of cool to tell your story again and be like, oh, you know what? Like that one thing that was so important that dictated so much of my life, it's actually not that big of a deal anymore. I don't have this, like I have other things that are a bigger deal that I want to focus on. So I think, like kind of like letting go of that fear of, oh, well, they know me. And so I just can't tell my story again. Like, I don't want to start over with somebody new. That's just always how I pitch it. Like
that's such a good point. Yeah. And recognizing too that, some of that content may be traumatizing, right? And the idea of having gone through it the first time was hard enough, explaining it to a therapist and then having to explain it to another therapist feels totally insurmountable. Very, very understandable. I think you can say that, right? If you're starting with a new therapist, I'm going to give you sort of, the top level info about my history and upbringing with my family. And then as I get to know you a little bit more, then we could talk more in depth about some of the more challenging parts of my childhood, for example, right? But I think just like overall, I remember from my personal experience, just feeling like I was wasting my time with that person, right? And time is precious, and it was wasting my time and my money too. And so if you don't feel like you're getting anything out of it, or you're not making progress or seeing anything shift or having good insights be fed back to you during the therapeutic process, that person just might not be the right fit for you. And there are bad therapists out there. I just want to put that out there, right? There are a lot of bad therapists out there. Just because people have gone through all of the training and the schooling and all that, there are some duds. And so listening to your gut on that, I think, is also, really important. Yeah. That's why I think that word of mouth really does come in handy too. And of course, the backline process, we don't know the therapists that we practice, that we partner with rather as well, for example, as a friend of yours might though, right? We have, a 30-45-minute phone call with them to get some understanding of, specialties and training and all that stuff. But I think word of mouth is also like incredibly invaluable in that for that reason too. Absolutely. Yeah. Let's see, I'm looking at the questions here to see if we hit most of them. I think just a few things, and I think I said this in a few, maybe in a few different ways, but once in the process of therapy, let's just say you had 2 referrals, felt really good about one, start the process, and then I think some things to be mindful of as you're moving forward into ongoing treatment is, are you feeling seen and heard? That's a huge one. Do you feel like your therapist picks up on subtleties? Are there things maybe that you're not saying, but that they might say to you? I'm wondering if this might resonate with you or feel true to you. Are they responsive and engaged? That's a huge one. And are they adding pieces to your understanding? I think typically a good therapist will help clients connect the dots and pull them towards greater self-knowledge versus just letting them ramble, right? And then sometimes, honestly, people ramble. It definitely has a negative connotation, but I've had clients before who just chatted, and then at the end would say, oh, that was so helpful for me. Thank you for listening. And that's really what they wanted out of therapy. So I think it's so uniquely individual in what it is that you're looking for. So having, like Amanda was saying earlier, like having an understanding of what it is that you want out of that process and out of that therapeutic relationship is super important to identify as much as you possibly can, have an idea of before getting into the process. And then hopefully the therapist will help to be able to guide you in elaborating on that and defining it more in detail.
I also like to encourage, especially people that are feeling a little nervous about, starting therapy or starting with a, particular therapist, but you're never feel like you're locked in. Like sometimes it can be helpful, like, yes, do the 15-minute consultation, see how that feels, then do it, if you're like, okay, yeah, I think I get a good vibe, do a session and just continue to assess because like they will understand, like if, you're 2 sessions in, 5 sessions in, whatever, and you're like, you know what, this is just, I don't know, this isn't quite the right fit for me, then it is more than okay to, have that be a thing and continue looking for somebody that is the right fit. Like you never have to feel like, oh, if I choose this therapist, then that means they have to be my therapist for the rest of my life, or even just for the rest of, this thing. I think it's okay to just continue assessing.
Yeah, absolutely. And I know that this is actually not something that we had maybe planned on talking about, but it feels maybe important to mention the differences between therapy, whether or not, again, it's a social worker, professional counselor, marriage and family therapist versus psychologist versus a psychiatrist. And so psychiatry is a different ballgame in that they can prescribe medication, right? And a lot of psychiatry, and I don't want to speak too much because it's totally out of my realm of expertise, but a lot of psychiatry is focused on medication management. You tell me, Amanda, but I feel like I've heard from a few different people, well, I've been seeing that their psychiatrist operates as both their ongoing talk therapist and medication management provider. It's definitely more rare, but what are your thoughts on that?
Yeah, I mean, I think that, yeah, it's funny. I think that psychiatrists get like very quickly like grouped into one thing, just because psych is in the beginning and people get confused about like what's
right.
what, which is totally understandable. But
Yeah.
how I work with psychiatrists is like everybody has a different stance on medication and how much they involve medication and treatment or not. I am always happy I kind of tell my clients if that's something that they're really interested in, happy to send you referrals of psychiatrists that I trust. And then I can work with them. Like if you sign a release of information, I can work with them and kind of just be like, okay, what do you see? Like, is there anything that I'm missing? Is there anything that, I'm seeing that you don't see? And so it can be nice to kind of have like a treatment team to work with, but also some people don't like medication at all and would rather just do, like talk therapy or different interventions that don't involve medication. And I think that different things work for different people. Like it really is not one size fits all. I do that like case by case with my clients. Like I'm never like off the bat, like, so who are you seeing? Like if they are already taking medication, I'll ask about it, just of like, how is that going? Like, does it feel helpful? Great. If it doesn't, cool. Let's figure out other things that might be helpful. Again.
Yeah, I love that. I'm glad that we brought this up because I think the idea of wraparound care can be so helpful for people, right? To sign that, you would have to sign a piece of paper. It's called a release of information that would allow, for example, Hallie as the psychiatrist to speak with Amanda, who's the person's therapist, right? And then from there, we can consult again about what we're seeing, how we're both approaching treatment, et cetera. But it can be, yeah, so helpful, especially if typically with psychiatry, I don't want to overgeneralize, but it is shorter. You're seeing someone for a shorter period of time and not as frequent. So it really is more just, the doctor checking in with you about how the medication is going, any adverse side effects, how you're seeing it being helpful, hopefully, or any, concerns you might have about it. But with your therapist, right, that person, depending on the cadence in which you're seeing them, is going to have a better understanding more about sort of what the whole picture for you looks like. And so being able to give that perspective to the doctor also can be really helpful. And this is actually sort of primarily how we approach it at Backline. We do have a few psychiatrists in our network, but often when people come to us looking for mental health care providers, and they're looking both for a therapist and a psychiatrist, we often recommend that people start with a therapist and then ask for a referral from your therapist. As Amanda just said a few minutes ago, she'll refer to someone that she trusts and has worked with before. Because again, there are some dud psychiatrists as well, where I've heard from a lot of people, I just feel like a number to that person. They're just, checking a few boxes and writing me my prescription, where I have also met some psychiatrists who don't approach their work that way and really do have more of a inviting, empathetic, validating sort of approach to their much shorter sessions with folks if they're just doing medication management, for example. And so getting a referral from, again, a word of mouth, maybe someone, maybe a friend or a colleague or something, but also from your therapist, I think can be, that's the way that I recommend that folks explore that option. So I'm glad, I know we hadn't talked about that, but I'm glad that we brought that up, because that's definitely something that also can be a little confusing about how to navigate.
Yeah. And also insurance provider too, like insurance that can be really helpful for finding a psychiatrist. That's what
For
they
sure.
Because it's not as like with therapy. I mean, it's different for everybody, but I really suggest, especially at the beginning, like doing it weekly. So you kind of have that cadence with somebody and start to really feel like you're getting those results. But with a psychiatrist, it's not necessarily as frequent. So it might be you meet with the person and then check in 6 weeks or check in 8 weeks. Yeah. Whereas therapy is a little more, like weekly, bi-weekly, whatever.
Sure.
Makes sense.
Yeah, for sure. Well, I knew that we were talking earlier about, like, are we going to be able to fill the whole hour? And of course, I had a feeling that we would be able to. We are coming up on time. We have about 5 minutes left. And just wanted to take any questions. I don't see any in the Q&A thing, which this is my first time doing a webinar, but I'm pretty sure there's nothing there.
Yeah.
But if anyone has any questions that we didn't address, or anything, specifically, you can, if there's anything specifically that you would rather not share in the chat, that's totally fine. I would be happy to put my email in the chat also, and you could reach out to me if you all have any questions that you'd rather have private. But if there is anything that anyone would like to have us talk to briefly, please feel free to pop it in the chat or the Q&A, and that is my email address. But if there are no questions, I think that we covered most things. Again, if anyone has anything that, again, that we didn't get to today, feel free to shoot me an email. I'd be happy to answer any questions about Backline's case management process, getting in with the provider through our case management program. But other than that, I'm so happy that we were able to do this. It was really nice, again, to have your perspective, Amanda. Oh, we do have someone. Okay. We can't see your email. Yeah, I don't know.
Oh, the chat is disabled.
The chat's disabled. Okay. Now let's see if I can type. My email is Hallie, Hallie @backline.care. Let me see if I type it in here.
If you go to Q&A, click your live, I think you'll be able to put it in there.
Will you do it? I don't know how.
Yes.
I see answer. Oh, answer live. I see.
Yeah.
I don't know how to do it.
Oh,
If I answer it live, I think it might just be talking it. How about that? Can you all see it there? Did that work, everyone? Do you see that, Amanda?
yes, I do.
Okay,
I do
cool.
see that.
Again, it's Hallie at backline.care, HALLIE. But thank you for letting me know, and I apologize for my lack of technical abilities. This is the first time that I've done a webinar, but I think it was somewhat seamless, except for that part.
Yeah, we did it.
Okay, cool. Well, thank you so much for joining us today. It's been really nice again to get the perspective, your unique perspective, because not everyone has, both sides of the coin. And Amanda is in our network of Backline partnering clinicians. So yeah, and she's awesome. So highly recommend. Yeah. Well, I hope you all have a good rest of your day. Thank you for being here. And I believe that this will be posted to our socials or to YouTube if there's anything that you wanted to circle back and watch again, if there was anything that we might have gone through too quickly or something like that. All righty. Thank you all for being here.
Thanks for having me.
Thanks, Amanda. See you.